From the very beginning, we were concerned about the impact of humanitarian care on the local doctor. We like to work with the local doctor. We like to find the local doctors who are willing to give a percentage of their practice, of their time, of their skill to taking care of the less fortunate. At the same time, we recognize that these doctors need to make a living themselves. And there's an important balance that has to be accomplished there. The attitude for years has been that the people in the developed country need to send doctors over to the developing country to do the work for them. We're concerned about doing humanitarian work in a country and leaving the local doctor out. The local doctor needs to be involved. He's the one that knows best which people really need help and which people can afford to pay something. He's the one that's going to be there when the visiting doctors have left and gone back to their practice in a foreign country. We want that local doctor to be successful. We want him to have an active and successful private practice that provides funding for his family, and be able to then, at the same time, give a certain percent of his practice to the poor and the people that need help. We're always looking for the local doctor with heart. If we bring in a group of American doctors or from any foreign country and set them down and say, okay, they're going to do all the cataracts in this city while they're here, then we're taking advantage of the local doctor. We're putting him out of practice. And that's not good. That's not good. It's an interesting balance that we have to try to reach here. And it's easier when the local doctor is involved. He can tell us, look, I can handle, with a couple of my colleagues, we can handle the number of patients that need help. Or he may say, it would be nice to have a foreign doctor come in for a week or so to work on this specific problem and maybe teach us a few things about it. Anyway, we're concerned about the economics of humanitarian work. And the other thing is that when foreign doctors come to a new country, they're dealing with drugs that often they aren't unacquainted with. They have different names. The equipment that in the operating room is going to be different, and maybe it's stuff that they are not used to. Maybe they have equipment that they really feel that they need in their homeland, and it's not available for them in this area that they've come to for a short visit. There's no question that the local doctor really does know how to fish in his pond better than some visitor who's brand new. He knows where the snags are. He knows where the fish hang out. He knows where the underground springs come in. And without making use of him, we're making a big mistake. But we want that doctor to also, if he's contributing to humanitarian things, we want to make sure that he is successful in his own practice too. And we always keep that in the back of our mind. How is what we do impacting the local doctor?